Hello, our dear viewers. Welcome to today's episode on Afya Health and Lifestyle Interview Series. In today's episode, we'll be talking about mental health and mental wellness. And with us, our guest, Dr. Simisola Alabi. She will be talking to us extensively on mental health and how we can take care of our mental health. Before I bring her up to discuss this with us, I would like us to get to know her better.
Dr. Monica Simisola Alabi, usually referred to as Dr. Simi, is a practicing clinician, healthcare system expert, and speaker. She completed her initial medical degree at the College of Medicine, University of Lagos. She started her training in obstetrics and gynecology, but subsequently went on to gain a CCT in general practice in the United Kingdom. She is also an alumnus of the University of Bedfordshire and Imperial College London. Dr. Simi has had a long career in healthcare leadership. Her roles have included advisory to the Secretary of State for Health, clinical lead for population health in BLMK Integrated Care System, clinical director of a primary care network, clinical director for various departments in a CCG, and assistant clinical chair of a CCG. She has recently taken on a role with United Health Group. Dr. Simi is also a partner at a practice. She also has a role as visiting consultant in family medicine in her alma mater. In her spare time, Dr. Simi focuses on providing support to clients in the wellness and aesthetic space, providing concierge health services, and having a line of supplements. She also developed a mental health journal with an accompanying course. Dr. Simi started a not-for-profit in 2019 called Beyond Wealth in honor of her mentor, Dr. Yinka George, and she recently published her first book, which is now available on Amazon.
Good day to you, Dr. Simisola Alabi. Welcome to Afya Health and Lifestyle Interview Series. Would you like to say hi to our viewers?
Hi, everyone. It's a fantastic honor to be here. Thank you for inviting me.
All right, thank you very much, ma'am. Without wasting our time, we would like to go straight into business of the day. When we talk about mental health and mental wellness, when we look around us, there's a lot of talks and awareness concerning mental health and mental wellness. And to avoid misconception, to avoid misinformation, can you generally, in some way, tell us exactly what it means when people say mental health and mental wellness, so that our viewers will have a very good understanding of what we are discussing today?
Yes, I think we talk a lot about mental health, and that word is thrown around. And generally, people think that it's, oh, maybe somebody's crazy or not quite there. However, when you think about mental health, is really being in a state of well-being, where you are able to cope with the normal stresses of life. You have self-belief, you believe in yourself, you're able to contribute to your society as well. That's what being mentally healthy means. It's just a state of well-being. And we are all on a spectrum. So some people are very mentally healthy, and while some of us struggle and need a bit of support.
Thank you very much, ma. So, looking at that, how do we know? How do we tell if somebody around us is not mentally healthy, and how can we help? Because from what you have said, it is a general well-being of somebody. And it is very important that we watch out for the people around us. So how can we tell? How can we know when to offer help to people?
Right. Okay. I'll talk about this because I think there is a bit of a misconception again. Being mentally healthy doesn't mean that you don't have a mental health condition. So someone might suffer with depression, but they are mentally healthy because now they understand what their situation is. They know what the problem is with them. They've sought help either through counseling, with having the right people around them. They identify their triggers. Maybe they might even go and see a psychiatrist if necessary. Sometimes they might even be on medication. So you can have a mental health illness, but still be mentally healthy because you're able to have that insight. Now, if you have a situation where somebody cannot cope with stresses, or they're highly burnt out, or they have a mental condition that is poorly managed, then people start to suspect. So, for example, if we're talking about someone suffering from, let's not use depression, because depression is the most common mental illness, as you know, and is one of the leading causes of people not being well. But it's so talked about. Maybe we should talk about it as well. But I want to use something like burnout, for instance. Burnout can present very closely to depression, and people may not recognize that. And in fact, the person suffering from it may not identify that. So let's take an example of maybe a medical student who is burnt out from the work because it's so stressful. So they begin to become tired, irritable, they lose interest in their work, maybe they won't go to lectures, just feel totally exhausted from maybe the sheer volume of the work. Now that can be burnout, and you may see that. And you would know because this person wasn't like this before. So you might notice that somebody's actually looking a bit sad. And our job, because we're all watching out for each other, is to ask. It's different if someone is feeling sad for one day. You should ask anyway. However, if this is becoming protracted, either with stress, which can then lead to reactive depression when it goes on for longer than 2 weeks, then really you should be more aware. And if we're thinking about other people, then we're attuned to them. We have to live in a selfless world because the world right now is challenging, is difficult, is busy. There's so many distractions. But if you love people and you love your family and you love your friends, you would notice. And all you need to do is say, how are you? And not just the how are you of, oh, how are you or how you did and moving on, but actually say, no, really, I've noticed that you look a bit sad. Is there something going on? And is there any way I can help you? People respond
All right.
more to genuineness than just the surface asking.
Okay. Thank you very much, ma. From your explanation now, we can tell that you've informed us that depression is basically the leading cause of health problems.
Yes.
Looking at the world around us, the stress, the pressure, it is very, very understandable. Now, how can we do better? What do we need to watch out for? How can we reduce this pressure, these stressors that can lead to depression? And when we find ourselves in such positions, or our friend in such positions, what should we do? What should be done?
The best thing is to not get to that point. So I'll use a two-pronged approach here. Prevention for me, it's all about wellness and making sure that either you as an individual or people around you don't get to that point. And how can we make sure that we don't get to a point where we are actually depressed or have, and depression is a very big word. There are many things under depression. It could be psychotic depression, it could be reactive depression, it could just be plain clinical depression. But I will say that we should work on prevention. And how can we prevent being mentally unhealthy so that we don't get to a point where we then have a mental illness? Is looking at things like our daily habits. The first thing is your daily habits, and you have to be militant about it. And it's even more important now. Having a routine helps to give you a sense of control over your own life. So, a simple check: what is your daily routine? What do you do when you wake up? Exercise, we know, makes you have a better mental state. So when you wake up in the morning, are you exercising? Are you meditating? Are you checking in with yourself and saying, how do I feel today? And then using that as a plan towards the day. Do you have a plan for the day? So for me, daily habits are important. Also, as part of your daily habits is making sure that you have the right supplements. I have a line of supplements, so I have to talk about supplements because we know that vitamin D, for instance, will help improve depression. And we know that vitamin D is important for your mental state, and that's been researched. So again, add your supplement to your daily routine. That's one. I have like 5 areas that we need to look at to be mentally healthy. Depends on how much time we have.
All right, thank you very much, Ma. Our dear viewers, do not forget to subscribe and to follow our pages across our platform so that in subsequent interviews you'll be able to be notified and you'd learn one or two things. Moving on to more questions, you've been able to highlight our daily routine and supplements as important factor in helping with depression and mental wellness as a whole. But looking at our country now, looking at our country, what are the important steps to take? Yes, daily routine of an average Nigerian would be to wake up in the morning as early as 4:30 and hurrying to get to work or to school. Um, the stress of work, the traffic, um, financial stress, family, putting all of those into context. What advice do you have for Nigerians?
Yes, I'm a Nigerian and I spend a lot of time in Nigeria. So for me, it's making sure that whatever we're talking about is realistic. Now, there are some things that you cannot do anything about. One of them is the traffic in Nigeria. There are so many other things, the financial pressure, the lack of good health care. There's so many things competing with your mind to get you to a point where you just give up. I still say that even in Nigeria, once you wake up in the morning, even if you have to leave home at 4:30 to get from Ikeja to Victoria Island, have a routine. It might mean that you go to bed earlier the night before because you get home at 9 o'clock from work. You might mean that you go to bed earlier the night before, but when you wake up, even if it's 30 minutes, spend that 30 minutes with yourself. And if it means that you would open YouTube and do 10 minutes of exercise, there's so many routines out there. For instance, I use an app and I use an app for meditation and for yoga. I don't pay for it. I use an app. I will say if I can do 10 minutes, I'll do the 10 minutes for that day and I'll have a plan for the week. So is you making sure that you adapt to your environment. So as in Lagos, for me, it is a case of working out at home, using an app so I don't have to spend that extra money or I don't have to get to a gym if I can't afford, if I don't want to go to a gym, pray. And pray doesn't necessarily mean, just have a connection with your spiritual side. It is so important. And if that's a form of meditation, just being quiet. So in Nigeria, that is even more important than anything because of the amount of stress. And again, the lack of healthcare means that it is even more important. Because if you don't do these steps, then you will end up developing a chronic condition, which will then mean that you will need a hospital. And know that in Nigeria, 74% of the healthcare is private. People are paying out of pocket. And if you get ill, it means that there's even more problems. So all of these things I'm talking about is so that in the long run, you don't have more problems. By taking half an hour to follow certain steps every morning, you will prevent long-term problems for yourself.
All right. So thank you very much, Ma, for the information. Moving forward, um, when we now find ourselves, yes, we should pay attention to prevention. But when we find ourselves in these positions, in these places, how do we get ourselves out? Where do we turn to? Who do we go to? What are the helplines available? Who do we call? And is there enough awareness? Yes, people throw the word around mental health or mental wellness, but there's been a lot of misconception, a lot of misinformation. So, what are the channels of passing out adequate and correct information to people so that people can really, really know what to do and what not to do?
There is not enough awareness, I'll say that. There is not enough awareness. Even though we talk about mental health, when you actually want to discuss it in depth, people still avoid being associated with the word mental health or being mad. If you're feeling sad or feeling not that something is not quite right, the first step is to know what's wrong, right? So the first thing you want to do is what is actually wrong with me? So the only way you can know what's wrong with you, the only person that really knows what the issue is you. Because if you're sad, if you're crying all the time, if you're not interested in doing all the things you normally are interested in doing, these are all signs of depression, by the way. Again, there are many other mental health conditions, many, many others, and we can't cover all of them today. So if you find yourself in that situation where you are feeling this way, first of all, check in with yourself. What is wrong with me? The second thing you need to do is to speak to somebody, not necessarily a doctor to start with, but someone you trust. One of the dimensions of a good mental health is having a good social network. So that could be your friends, your sisters, your brothers, your husband, your wife, having one or two people around you that you trust. Those are the next people to talk to. Say to them, I'm not feeling quite right. This is how I'm feeling. Because sometimes just discussing that alone will start to make you feel better. Then the third thing you need to do, if that has not helped, is to now go and find a healthcare professional. A healthcare professional is always the first step, because a healthcare professional will be able to signpost you to either go and have counseling here, call this helpline, when I say a healthcare professional, I mean a primary care specialist. So a family physician. So you cannot go to a neurosurgeon for this. You need to go to the appropriate specialty. And you really should not be going to a psychiatrist either. The first step is a family medicine specialist, a consultant in family medicine, who can then take a history, talk to you and say, okay, I think you need to go and see a psychiatrist, or I think you need to go and see an approved counselor. Unfortunately, in Nigeria, I think many of these things are still out of pocket. We're still having to pay for these things out of pocket, although there are quite a few charities that are looking at mental health as well. So that's the third thing. And the family medicine specialist may be able to start you on medication if it's needed. There is no shame in starting antidepressants if you need it. There is no shame in that. But you have to speak to somebody first and get a diagnosis. And then fifth, the other thing to do is we are in a world of technology. Healthcare is going down the AI route, virtual reality, and lots of innovation and technology. Telemedicine is exploding. So everybody has to get with the program. There are thousands of apps out there, and there are some that maybe I'll recommend off the record that are good for mental health. That you can go in and check in every day. You can see how you're feeling. There's so many of them, and we actually prescribe these apps out to people as well. So those are some of the things you do if you find yourself in a situation where you feel like everything is collapsing, everything is too much, I can't cope. And finally, because there are some people who get so low that they might feel suicidal. They might feel there is no point living anymore. And this is a very real thing. And I have seen many patients in this situation, and some of them have gone ahead to attempt to take their own lives, and some of them have been successful. Now, you need to have, once you have that thought in your mind, it is important that you verbalize that thought to someone, because you may need medication, and that is so important. And there is no shame. Listen, I always say to people, if you have a heart attack today, you will seek help, won't you? You won't sit at home and say, I'm ashamed that my heart did not work very well. You won't stay at home and say, my pancreas did not produce enough insulin and I have diabetes, I'm ashamed. So why would you be ashamed of something going on in your brain that is causing you to feel low or depressed or sad? Why? There is no shame in it at all. So that's what I would say. And again, I can go on with many more tips on what to do. But again, I'll give it a pause there for now.
Thank you very much, ma'am. Our dear viewers, if there's one thing you are going to take away from this interview, it is that you should not be ashamed. There's nothing to be ashamed about. Seek for help. And our guest has already outlined some of the things you need to do, identify the fact that something is wrong somewhere, speak to somebody, then seek help with healthcare professional. It is okay to take medication. And if it feels worse, please verbalize whatever you're thinking in your head. So if we can take all of these steps, we would have a better mental health. We would be able to take care of ourselves in due time before things get worse. Ma, before rounding up, what do you think are the very few general misconceptions that you wish that would be thrown out so that people can be more comfortable discussing their mental health and seeking help concerning their mental health? And also, is there any day of the year set aside to create awareness for mental health?
There's definitely a World Mental Health Day. I think we just had it in October, I believe. So there is a World Mental Health Day. And if you go on my page, my Instagram page, you will find some resources there. And obviously, we have a mental health journal. But just to go back to your point around misconceptions, and before I delve into misconceptions, I also want to say to the viewers, first of all, everybody has a mental health that they are looking after. The same way you are looking after your physical health, your mental health is also meant to be looked after. So everyone is on a spectrum. So the first misconception is that maybe some people have, oh, they have this, that is only these people. Everybody is on it. It's different to having a mental illness where you can see some familial tendencies. And there's still the question around nature versus nurture. That's a whole different argument where maybe you will see schizophrenia running through a certain number of generations or depression running through. That's a different thing. But everybody's on a spectrum. And then one of the other things I also wanted to share before I go get into misconceptions is now your mental health is a sum of everything you're doing moment to moment. So every single minute is shaping your mental health. And challenges come from everywhere. All sorts of input is coming from everywhere. So to have a good mental health as well, how you deal from moment to moment is very important. So when something comes towards you, a threat, something comes towards you, what I would like you to do is to pause. Learn not to react immediately unless there's imminent danger to your life and you have to run away. But if someone says something to you, for instance, someone does something to you, pause. Pause first. Secondly, breathe. Because when we get heightened and we're getting stressed, our breathing becomes shallow because it's the fight and fear. You're pausing for a fight, right? So
Yes.
immediately take your mind straight back to how am I breathing? Am I breathing from my stomach and taking full breaths, or am I ready for a fight? So pause, be aware of your breathing, accept what has happened, accept that somebody has done something to you, something has gone wrong, somebody has hit your car, so many things happen. Just accept that it has happened, right? You're taking a breath, you've taken a pause, you're not getting down from your car and punching somebody because you're so angry, because that will only make things worse. Accept what has happened before you speak. There is so much merit in going inside yourself and being very aware of yourself. And it's a sum of these behaviors that add up to somebody who is mentally healthy. And then you say, oh, that person is really calm. They might not be naturally calm, but they've trained themselves to always pause, to be aware, to take lots of deep breaths before they actually speak and make a decision, right, on what you're going to do next. So that's what some little tips there. There's so many other tips that I can give you. Now, back to misconceptions. People think, obviously, somebody having a mental health is mad, and that word mad, crazy, we should be very careful how we use it. If you see somebody behaving in a certain way, you don't know what has happened to them to have caused them to behave that way. So I generally tend to stay away from words like, and I'll advise you to do the same. Don't call somebody crazy because they are crying or shouting or screaming. Don't call them mad. If somebody has a psychotic breakdown, don't start saying, in Yoruba, we're learning it. Nah. And even for people who are mad on the streets, it may be that they are not taking their medication. It may be you don't know what has happened to them. We should come and lead with compassion. The world is hard enough. So, misconceptions, madness is something that we shouldn't be talking about. Seeking therapy, going to therapy or going to counseling, there's nothing wrong with that. Counseling just helps you focus your mind. So this misconception of, oh, I don't share my problems with anybody. I don't talk to anybody about my issues. I keep it private. It's not going to get you anywhere. If you need counseling, go and have counseling. I'll pause there, but there's so many other misconceptions.
All right. Thank you very much, Dr. Simisola Alabi. This has been very, very enlightening. I'm very sure our viewers would have learned a lot from this interview. Really appreciate you coming to join us on our platform. Thank you very much, ma'am.
Thank
So
you.
we have come to the end of today's interview, and please, if you are not following our page, go ahead to follow us across all platforms so that you can, and do well to subscribe so you can get notifications every time we have a new upload, every time we have a new interview on our pages, so that we can keep learning, we can keep making our lives better, and we can live healthy. Afya Health and Lifestyle Interview Series is basically here to provide good health tips to help have a generally healthy community. Thank you very much for joining us today. To our new subscribers, we say welcome. To our old subscribers, thank you for joining us once again. Have a good day. Thank you.